This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right. Good morning, everybody. So in general, I think I and most people like to think of the emergency department as kind of a team-oriented environment. We work closely together. I think here at Swedish, it's very much the case where I think we have a comfortable working environment. People feel comfortable working with each other. And in general, that tends to lead to better outcomes potentially. People feel comfortable speaking up when they have a concern or a question, and I hope it leads to better safety and better patient care. There was a study that tried to actually look at this and really analyze this question, and it was an interesting study. It was at Mass General, where they took medicine residents and randomized them to either work in the same team environment with the same groups of nurses in the same ward for 16 weeks, as opposed to rotating through 4 different units with different staff, different nurses. And they tried to see over a year if that made a difference. And interestingly, at about 6 months, they found that the nurses did feel more comfortable with having a better working relationship, being able to ask questions, felt like there was a better work environment. And then at 12 months, they actually compared these 2 teams in a simulation model to see if they did better addressing difficult patient situations. And they did find there was improvement in how teams worked when they had worked together longer, which makes sense, and potentially just did better overall. So I think it's a kind of an interesting little study to analyze something that we think about as being a real thing in the emergency department. And I think it does matter. It does make a difference. A better working environment. It's more fun to work in this kind of environment. And we keep doing things, the UBC keeps having, social hours and holiday parties and things that make us happier to work in an environment, but hopefully actually translate to better patient care because we feel more comfortable working together. All right. Thanks, everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.